based on the question, how could better subtyping of cholangiocarcinoma improve outcomes in Asia? In myself is a surgeon, and for me the subtyping of cholangiocarcinoma is very useful because if we could have the good record or registration like intrahepatic cholangiocarcinoma, perihilar cholangiocarcinoma, and also the distal cholangiocarcinoma. In the point of diagnosis and treatment, surgical retreatment, it's very, very important for us. Why? Because the diagnosis of intrahepatic cholangiocarcinoma and perihilar cholangiocarcinoma is very crucial. Because it's very difficult to differentiate between the intrahepatic cholangiocarcinoma and perihilar cholangiocarcinoma using the images like CT or MRI. And then if we could diagnose the intrahepatic and perihilar cholangiocarcinoma, the treatment surgically is very different. For example, that intrahepatic cholangiocarcinoma, we only do simple hepatectomy, but in perihilar cholangiocarcinoma, if we diagnose perihilar cholangiocarcinoma, we have to do extra hepatic bile duct resection and reconstruction, and or vascular resection and or reconstruction, and we must do the hilar lymphadenectomy in every cases of perihilar cholangiocarcinoma. But in intrahepatic cholangiocarcinoma, hilar lymphadenectomy quite controversy, do it or not, or something like that. So if we could diagnose intrahepatic cholangiocarcinoma and perihilar cholangiocarcinoma before decision making of surgical treatment is very useful. If not, the results of intrahepatic cholangiocarcinoma, if we misdiagnose from perihilar cholangiocarcinoma as intrahepatic cholangiocarcinoma, and we treat just only hepatectomy, the result, long-term survival is not good because it's wrong treatment. So that's why it's very useful for us if we have a new classification and registration in ICD-11 for subtyping intrahepatic, perihilar, and also distal cholangiocarcinoma separately. This is I think it's very useful, especially in our field of surgery and curative surgical treatment for cholangiocarcinoma, especially for the intrahepatic and perihilar cholangiocarcinoma. That's very, very important for us. Another reason for improving the result and registration by using subtyping like this is we could improve the neoadjuvant or maybe adjuvant or also the advanced chemotherapy or targeted therapy in the intrahepatic, perihilar, or even distal cholangiocarcinoma, because the genomic classification of the intrahepatic perihilar and distal cholang is quite different. If we could diagnose it before any treatment, the advantage of the patient regarding the genomic classification of the intrahepatic or perihilar or the distal cholangiocarcinoma is very important. So I think I agree to use or to encourage using of the ICD-11, having the subtyping cholangiocarcinoma. And also in Southeast Asia, cholangiocarcinoma in Southeast Asian country, it is the liver fluke-related cholangiocarcinoma. And from some study, the genomic classification of the liver fluke-related cholangiocarcinoma in this region is not the same as in the West country cholangiocarcinoma, that is non-liver fluke-related cholangiocarcinoma. So we can develop our research in the field of genomic classification because I think the knowledge gap in the study of genomic classification in our Asian patient in cholangiocarcinoma is important too. So in the point of view of the new research is important for us too. And for the subtyping like this for the prevention and screening, and also surveillance of cholangiocarcinoma in Southeast Asia and Asian countries, for such as in South China, Taiwan, or Korea. It's I think some points it support the prevention and screening and also the surveillance for early diagnosis of liver fluke-related cholangiocarcinoma in Southeast Asia and in Asian country too. So I think this point is good for encouraging the using of the ICD-11. And I would like to add some like surgical training. For hepatobiliary and pancreatic training, it's good to emphasize the technical of the hepatectomy in the intrahepatic cholangiocarcinoma, perihilar cholangiocarcinoma, and distal cholangiocarcinoma, especially in the intrahepatic and between the perihilar cholangiocarcinoma. We need to train more and more surgeons for this, because in Thailand and also in Southeast Asia, we have more than 30,000 cases of cholangiocarcinoma, especially perihilar cholangiocarcinoma. If it's emphasized the registration of the polyhydra cholangiocarcinoma using the ICD-11. We could raise this for the policy in the public health or even in our surgical society to emphasize how to make or train the surgeon who know very well specialized in the hepatectomy and bile duct resection and all vascular resection or reconstruction. So this I think it's very important for training of the surgeon in our Southeast Asia, in Thailand and Southeast Asia and in Asian country, in the point of the polyhydra cholangiocarcinoma that need very specialized technique, very special training for our surgeon in this area. So I think this is my opinion to answer the question that it could help or not in the forum like this. So thank you very much.